Joining me now is Tony Stein, the CEO of Healthcare Management Solutions that runs 70 care homes around the UK, including the Patcham Nursing Home in Brighton. Hello, Tony.
Morning, Danny.
So national insurance payments that we make, what does that pay for?
Well, to be fair, national insurance isn't in any way ring-fenced for anything. I mean, it's another tax. It's an outdated system. And frankly, whether we raise money through national insurance or income tax is almost irrelevant. The money just goes into one big pot and it's shared out. The difference, of course, is that national insurance and income tax affect people in different ways. So it kicks in earlier, does national insurance, and if you're over pension age, you don't pay it. So it's a bit of an anachronism. To be honest, we just need to fix that whole tax system anyway.
So if we need more money for care, is the national insurance the best way to get it, do you think? What would you have done? Personally,
I think I'd have looked at income tax as the way to do it. I think, first, can I say that there is a real problem in social care. There is a massive gap in funding, and that actually seems now to manifest itself in unmet care, particularly with some of the bigger urban local authorities not being able to afford to give care to people. So we do need to find some extra cash. And I have to say, some of these arguments that we're hearing from politicians make no sense at all. What they're saying is that the young shouldn't be paying for care for the old. But, the criticism the young have got is that the old never put enough away to cover the costs now. So what we're saying is, the young should start paying now because they're going to be depending on this when they get to a stage in their life where they need it. So, we need to find this money. We need to find a way of paying for it. Personally, I would have probably picked income tax. I just think NI is not the ideal way of doing it. But we also need to ring-fence this money because the problem I find is what we'll do is we'll ring-fence the money that we raise, and then the local authorities that are receiving it will just spend less from their normal budgets, and so it just gets lost in the system. It effectively just ends up filling a hole that they've got.
And give us an idea of what it might be like for one of the residents in your care home and how their care is funded.
Well, there's several ways that care is funded, but I mean, traditionally it's either going to be if you've got the assets and you've got the wealth to do it, you'll pay for your own care, and if you haven't, then the local authority will step in and pay for your care. So it can be funded either way. If you've got health needs, obviously, then that's paid through the NHS. But the issue here is, as a country, do we want to provide social care, personal care, in the same way that we provide health care? And if we do, we need to fund that somehow. We can't dream on that that this is just somehow going to fix itself, or we're going to find some money down the back of the sofa somewhere else.
Is that preferable from your view? Is that preferable? So, if you break a leg, it gets fixed on the NHS. If you get older and you become less able to look after yourself, we still look after you.
I think that's got to be the case. I think they've decided to do this over in Germany. They've got a fantastic model over there. They agreed an increase in tax to do it. Everybody, no matter where you live in the country, you will get care if you need it. Social care as well as health care. I mean, it's a great system. It was accepted it needed to be paid for. They accepted the increase. And the good thing is it's centralised funding. So if you live in a poverty-stricken local authority area, you aren't shoved on the back of a queue and never see that care coming. You will get it no matter where you live, and you'll get the same amount no matter where you live. And I think that's a system that we should strive for. This thing about manifesto breaking pledges as well, this really drives me nuts. I mean, the manifesto was drafted back in 2019. In 2019, we hadn't even heard of the pandemic. Since then, the country's gone through an incredible expense in trying to fight our way through this dreadful situation that we find ourselves in. And if that isn't a reason to change a strategy, then I don't know what is.
Sure, but the healthcare, the social care system wasn't running all tickety boo before 2019, was it? I suppose.
Well, no, and I think we all said, and Boris said at the time, didn't he? He said that we're going to fix this. He wants to fix this. Thank God, at last, some politician is going to grasp that nettle. But we can't do it in the same way that we might have done it back in 2019 because we've had that incredible expense since. So if he has to change his strategy, well, That's it's not surprising, is it? Really?
Well, it's interesting what you say about the German situation. I wonder whether there might be something in that for us. Tony, thank you for now. Good to speak to you.
Yeah, thanks. Cheers,
Thanks for your time. Cheers. Tony Stein there, the CEO of Healthcare Management Solutions.